Back to school season is in full swing, and as a lot of parents will tell you, you got to make sure your kid is ready. You got to get the pencils, you got to get the notebooks, you also got to get your health stuff up to snuff to make sure the kids can go back to school. One of the best ways to do that is making sure all your vaccines are up to date. Joining me today to share more, we have Dr. Ming Wu, family medicine physician at AdventHealth Littleton. Thank you for being here.
And thank you for having me.
It is immunization month, technically,
yes.
But also like right now is when a lot of kids are getting everything caught up because they're going back to school. So I guess let's start about, why is this, I know this is an obvious question, why is this important to make sure we're up to date, like as we send kids back to school?
Sure. Well, vaccines are kind of one of the major medical breakthroughs. We can prevent serious illness, not only for the children, but also for the community. And so you want to make sure that your kid is vaccinated, not only to protect your child, but also to protect those children that are in the school that maybe aren't able to get vaccines because they have allergies or they have other issues that don't allow them to get the vaccination.
A lot of schools are going to have parents fill out forms to make sure they're up to date. But if you're trying to check where am I on the schedule, have I gotten everything I need? I know pediatricians' offices, your offices, you guys will have those records as well. How do you double check where you're at with your list?
Well, you can always talk to your primary care provider. We normally have a list. Colorado actually keeps a list as well. They have a repository that we kind of keep track of all the immunizations that we have, just to make sure that we're up to date on everything. And of course, your PCP will have those lists as well, just to make sure that we're keeping everything up to date.
Every pediatrician I talk to and every family physician I talk to about this is now in this world of you've got a lot of questions. You got to push a lot. Families will push sometimes, I guess I should say. What are some of the questions you're getting? How are you trying to help families that do have curiosities about safety of vaccines, interest in vaccines? Like, walk me through those conversations you're having.
Sure. A lot of it is, they're concerned about reactions to the vaccine.
Sure.
I see a lot of that. And yes, when we give a vaccine, you can have a site reaction where, you get a little bit of redness there. You can have some minor illness. As your immune system reacts to the vaccine, it's doing its job. And so you will get some maybe sniffles, maybe a fever, a slight fever or something like that. But that's actually your immune system reacting to the vaccine and building that learning base so that if you get exposed to the actual illness, everything is taken care of and you don't get the serious illness. There are some concerns about other vaccines that have been out there. And we talk about, how we've tested them, how they've been studied, and how there's actually there's really no evidence that there's any drawbacks to them, those long-term safeties. We've done lots of studies and all of that has come back safe.
It's a confusing time for a lot of people because we see changes at the federal level. We see a lot of stuff on the internet. I would imagine it's hard to be in the position of a family physician or a pediatrician. Pediatricians I talk to say it's a really tricky time to walk through this with parents. But the point is, you got to walk through it with families, right?
Yeah, for sure.
Talk to me about, we're coming up on respiratory season. That's always a tough one for everyone. What do you see this time of year in your practice, and what's the best way to get ahead of it?
So right now, we'll start seeing a lot of flu, and then RSV are the two big ones. And of course, we do have the flu shot, which I do recommend every year in the fall, usually about August, September, October. Now's about the time where we start looking at giving vaccines. My office, I like to usually give it when I see the first case come in.
It's a good start point.
Yeah, usually a good start point. Haven't seen one yet, thankfully.
It's early.
I know, it is. Yeah, hopefully not for a few more months. And then also RSV, that is also, there's a vaccine available for that. And so, of course, getting
That's
those
more age dependent though, right? That's like older folks or young babies, not so much the middle.
0 to 6, and then we say now 50 and above, just to make sure. But, those are the more vulnerable populations. So, of course, we would recommend getting that for them.
Okay, we'll see how this flu season and RSV season stack up. That's been pretty brutal the last couple of years. Dr. Wu, thank you for coming in. As always, we always appreciate your perspective. We're going to take a break. We'll be right back.